Freud gave us the starting point of this whole project, which is pretty much loss, right? His theory was that loss caused depression. Now, is it that simple? I don't think so, but we want to examine loss a little bit, and that there were multiple kinds of loss that could be responsible for this, right? According to Dr. Freud, it leads to both depression and grief. We're not really going to talk about grief, but grief is very similar symptomatically to depression, except for it rarely involves like a loss of self-esteem, whereas depression, your whole kind of identity collapses in a certain sense, and loss of self-esteem is very, very common in cases of depression, right? So these losses, though, they're not always immediately obvious. We're going to get into this a little bit. For example, the loss of the ability to exercise one's potential in a certain area of life could play a factor. And something like that, I think you can see how something like that might lead to depression, or at least play a role in it, right? Furthermore, they can be both conscious and unconscious. For example, of the unconscious is kind of like the stuff that's in the back of your brain, not immediately accessible, not really there. And Carl Jung and Sigmund Freud had two slightly different definitions of unconscious, but we'll touch on both, right? But something like traumatic memories that were blocked out or partially blocked out or something like that could be repressed, and the theory at least is that they can still damage us even though they're not immediately accessible to our brain, right? So Freudian theory, he started the project for us, or gave us the starting point, which is loss. Types of loss, right? Fairly obvious: people, things, opportunities. But potential and imagined futures are a little harder to see, and I didn't really stumble upon that until I got into the research for this project. But I was able to see various things in myself, in fact, that I hadn't seen before when I examined these specific areas, right? So there's the obvious loss of a loved one causing grief or depression, right? But it can cause depression, right? But that's very surface level, okay? I use the example of postpartum depression. Now, I do not want to speak for any woman that's had a baby, because I am not a woman who's had a baby, or a woman. But it occurred to me that the very loss that they might have been experiencing, even though the baby's a good thing, is the loss of potential, really. The ability to, say, play their favorite sport, or live the lifestyle that they want to in like an active way, right? Now, the baby's a good thing. They want to take care of the baby, but that does not negate the loss itself, and that could be operative on their conscious level, or it could even be unconscious, and they could be, possibly confused. Ask a woman. I don't know, but this just popped into my head, so I put it down as an example, and I said, gee, could that be it? The loss of potential in a certain area, even though they're experiencing a good thing at the same time? I don't know. We'll have to ask. Okay. Also, according to Dr. Freud, less so than loss was anger directed inward. This could cause, I think, many symptoms, but depression was one of them, right? Types of inward anger, fairly self-evident, right? I failed. I didn't measure up. I should have been different. If I'd studied harder, I probably would have done a better presentation, wouldn't I? But I think this is going to be good. Remember, in examining these things like I should have been different can be quite harmful, right? And if I had studied harder, these are hypothetical past situations. Now, I just wanted to point out that the hypothetical does not, in fact, exist in reality, okay? It's a very useful tool for figuring things out. I'm not negating the value of hypotheticals. However, we should remind ourselves that in going back and wishing it had been a certain way, we're essentially engaging in wishing, which doesn't help very much in my experience, and that these hypotheticals don't actually exist in reality unless you're talking about multiple universes or some weird thing like that, okay? They don't really exist. So you're fretting over something that could have been, yeah, but doesn't exist now, does it? Now, the losses can be unconscious, as I mentioned, and that means, in simple terms, not immediately accessible to our mind, okay? Loss and anger sometimes lurk in the depths. I think that was a Carl Jung phrase. He loved to use the phrase "from the depths," I think. And they can be repressed, even from childhood. Sigmund Freud liked to look back into childhood to find underlying causes a lot. And they could involve universal patterns and roles, right? And that was more of the Jungian view of the unconscious, that there could be the obvious loss, like loss of a sibling as a child, right? That one doesn't necessarily remember that well, but it makes a huge imprint, and something like that could be significant, right? According to Dr. Freud. Jung could be a little more complex in that he zoomed out a little bit to the picture of universal human experiences. So, like, if the parent of the child that was lost, obviously lost the child on the surface, and that's grief enough, but they may have lost their potential to exercise the role of a good parent or something, a little more complex and a little more in the bigger context, right? So something like that, something to be aware of. Some stuff like that on a psychological level, at least, and there's more, we believe, but on a psychological level, could be causes of depression, right? It's theory that they still cause suffering and depression, even when identified or unknown. We can't really prove that, but in my experience, I kind of think so. Therapeutic implication of this? Well, want to identify where they appear throughout life, sometimes in childhood, identify them in the present, right? What are we experiencing now in terms of loss or even anger directed inward? And identify them in the imagined future. I didn't get into the school I wanted because I should have studied harder. That's the past. But my whole future crumbled because I wanted to get this degree, become this for a career, and live here, and it all fell apart, and my imagined future is crumbling in front of my eyes. It has crumbled, and now what do I do? How do I make meaning out of life? We'll get to making meaning soon, okay, in a different presentation. Carl Jung had a slightly different view of depression than Dr. Sigmund Freud. He distinguished between two types: the emotional type, which were intense and painful feelings, right? Like, I absolutely can't take it. This is hell. I can't take it. My life is this way. It's unbearable, okay? Very strong emotions that are very painful, hard to tolerate, right? But there is also the apathy type of depression, which I've frankly suffered from both in various times in my depression career, right? But the apathy type is kind of a more grayness than blackness, and who cares? Who cares? Why bother? Who cares? Who knows? Right? You just don't almost have the energy to exercise the mental effort to even care about something, is the way I would describe it, right? It's just too much effort in a depressed state to do something that seems pointless, because remember, the past, the present, and the future can seem quite pointless to a depressed individual, right? Not so for the average person.